So good afternoon, everyone, and welcome to Member Cafe. We are so glad that you've joined us today. So I am just going to wait just a moment or two. I can see our numbers ticking up. I want to let people have the opportunity to log in. So let's just hold for just a minute before we get started. So again, good afternoon and welcome to Member Cafe. I know we have 120 plus registered today. We're at about 62. It's still rising, so I'm giving it just another 30 seconds. Certainly want to be respectful of your time. All right, so welcome. We're here for Member Cafe today. My name is Ann Gluff. I am part of the member engagement team here at Partners Health Management. So also joining us on the panel today are from member engagement, our Beth Brooks, supervisor. Along with me, I'm a supervisor as well, Melissa Hatton, one of our STAR specialists. We have our guest speaker, who I'm going to introduce in just a few minutes, Dylan from the North Carolina Ombudsman. And Allison Crotty, Member Engagement Director. Thank you, Allison, for joining us today. And then we have Danielle Clark from our provider network. So thanks, Danielle, for joining us today as well. So today's session, I wanted to let you know that is being offered in closed caption. So if you don't need the closed caption, if you should see a post on your screen that says that it's there. You can just click on that to turn it off if you do not need it. Also going to share a little bit of housekeeping items with you, but before that, just in case you're new to Partners Health Management, I wanted to let you know that we are a managed care organization and we manage Medicaid and state dollars for North Carolina for our catchment area for services right now, behavioral health, for mental health, intellectual disabilities, traumatic brain injury, substance use disorder. As you know, tailored plan is scheduled to roll out December 1. So we're going to hear a little bit more about that from our guest speaker today. And at that point, we'll move to be managing physical health as well as behavioral health. All right, so a little bit of housekeeping. When our speaker begins, we're going to let her go through her presentation. And I know often when you're listening to a presentation, you hear a question, and if you have a question, if you have to wait to the end, you might forget. So feel free to click on the Q&A. Should be right at the bottom of your screen. You'll see Q&A with the little bubbles on top of it. You can enter your questions there. The chat is disabled for you. You will see information coming in through the chat, great links that you can go to, phone numbers for you, so you can quickly copy and paste from there. So that will be coming through the chat. Melissa is going to be helping us along with that. We are going to be recording this session. We are recording right now. So just be cognizant of sharing private information during the session. We'd be glad to talk with you at a later time. You can reach out to us for that to have a one-on-one session. And right before, I'm going to introduce our speaker in just a second, but one thing I want to share with you is that our session today is really focused on members. our individuals and our families that we support and serve. So I want to be sure that their questions are answered first. I know we have a large mix in our audience today, so if we could please just let our members and families get their questions answered first, we would be most happy to field any other questions that you have. So without further ado, let me introduce Dylan to you. So Dylan Samoska. Dylan, did I say that right?
Close enough. Don't worry.
All right, cool. She is a program manager for the North Carolina Medicaid Ombudsman and began working in her current role at the inception of the Ombudsman program in early 2021. So as a public health professional with more than 20 years of experience, they're committed to addressing issues of health equity and access to care. So Dylan, I'm gonna let you take it from here. You go ahead and share your screen and take it away.
Thank you so much, Anne.
You're welcome.
Just confirm that everyone can see what I have on my screen.
We can.
Wonderful. Well, it is a privilege to be here. Thank you so much for the invitation, partners. The North Carolina Medicaid Ombudsman is a program that began in technically April of 2021, and we are proud to offer support services to the beneficiaries of Medicaid across North Carolina. I'm going to go ahead and just begin with our presentation. We will talk a little bit today about getting help from the Ombudsman. We will talk a bit about managed care, preparing for the tailored plan launch, a little bit more about tailored care management, and then some questions and feedback from you all. So in terms of the North Carolina Medicaid Ombudsman, what we do is we provide free confidential support and education about the rights and responsibilities of beneficiaries within the North Carolina Medicaid system. Our goal is truly to assure that members are connected to resources like legal aid, social services, housing resources, whatever it is that is going to make the process of accessing care easier and more effective. Our focus is to assist beneficiaries in resolving issues if they come up within North Carolina managed care. And we really think about this mission in a sort of a four-pronged way. So we educate, we advocate, we refer and connect, and we conduct issue resolution. So those are the things that the Ombudsman is seeking to do. And while we do those things, we also track and monitor trends across managed care. And we spend a lot of time communicating directly with the Department of Health and Human Services and the NC Medicaid leadership at DHHS. The services that we provide, first, we always want to act as a source of information to beneficiaries and frankly to all communities across North Carolina. So we do educational forums like this one. We work to be certain that if providers want information, we provide that information. And then, of course, we act as a guide for members who may be in need of assistance doing something like filing an appeal for care or even filing a grievance if they have a strong concern about an experience they've had. Our work in terms of investigation focuses on investigating issues that members report in terms of accessing care. Any new system might struggle to meet the needs of those that are utilizing it. And as we develop the work that we do within North Carolina Medicaid managed care, when those issues come up, we are a source of support for both members and in some cases, providers even reach out to us and say, this particular beneficiary can't get this service and we are struggling to find the next right step for them. Can you help? And we certainly do offer that assistance. We act as a monitor to note what issues are coming up and to evaluate what trends might need to be addressed within our systems. And then, of course, we refer members to community services that address health-related needs. When we are informing and educating folks, we are doing a lot of work around letting folks know what's happening with the transformation to Medicaid managed care. And we're teaching individuals about how to manage this new system. How do I seek a prior authorization? How do I find out what providers are in my network? And what are, of course, my rights and responsibilities under this system? Our investigation, follow-up, and resolution model is really about being a true advocate for Medicaid beneficiaries. This is a role that we take very seriously at the Ombudsman. And when we are functioning in that capacity, our goal is to seek the best outcome for the beneficiary through informal issue resolution. And we do that by working with health plans, whether they're standard plans, LME MCOs, tailored plans. We also work with providers and billing agencies and the Medicaid contact center or the enrollment broker. All of those places are connections that we utilize to assure that we can resolve any concern that comes up for a beneficiary. As we're doing that, our goal is to always function as a no wrong door, which means that you can come to the Ombudsman with any question, and we are going to help you find the next step. So if moving you forward to working with the enrollment broker is the best next step, we will help you do that. And we assist in determining, do we need access to private health insurance? Do you need to work with someone who's a North Carolina ACA navigator? Do you need to work with someone who is helping someone with Medicare? Whatever that is, we help you find the right next step. And so those referrals that we offer are informal. Some of them are more formal, where we stay in the loop with you and help you assure that that issue gets resolved. But regardless of where it is, we want to be a place that you can always begin to seek answers and support. Some of the things that we don't do at the Ombudsman. So the Ombudsman can't provide legal advice or represent an individual with Medicaid in an appeal or a grievance. In other words, we will walk you right up to that threshold, that doorstep, and assist you in preparing to file a grievance or assist an individual in preparing to file an appeal, understanding what that process will look like. But at that point, we will step back and let them move forward individually. And then, of course, if someone needs legal services or representation for something like an appeal, we will refer them to the appropriate organization to do that. Our legal referrals do primarily go to 3 of our partners, our referral partners. Those include Legal Aid of North Carolina, Charlotte Center for Legal Advocacy, and Pisgah Legal Services. And those legal referrals do accept, those legal entities do accept referrals from the Ombudsman for members who need or request that legal advice or representation. So that's a bit about the Ombudsman, and I want to take a little bit of time to talk about managed care. So there are varying degrees of knowledge about managed care within every group, so I'm sure that that's true within this group as well. Please be patient if you've heard some of this before, and hopefully you'll learn a little bit that's new. Right now, the North Carolina Department of Health and Human Services is moving the Medicaid platform into a North Carolina Medicaid managed care system, which transfers the management of those services to health plans and also creates provider networks within those health plans. The Ombudsman role in this system is really to advocate for folks within Medicaid to assure that they get the help that they need and navigate that new system. The managed care timeline, we've seen a lot of this already occur. We know we're in the midst of it. So standard plans and the EBCI tribal option went into effect July 1st of 2021. And then, of course, tailored plans, which we'll talk about in a few moments, are coming December 1st of 2022. And we do know that there are anticipated future program rollouts as well. The tailored plan transition timeline that we have right now, we are kind of midpoint between August 15th and October 14th, actually, excuse me. So at the moment, what's happening with tailored plan transitions are that we are in the choice period. And the choice period relates to selecting a primary care physician and a tailored care management entity. And so we know a lot of members have questions and concerns about that process. If you happen to end up at the ombudsman with those questions and concerns, we are going to help you find the right place to go back. Usually that's going to be somewhere like Partners, your tailored plan. And we'll assist you with figuring out what those questions are and what you need answered. So the things that are coming next, we know that the choice period will end. So auto assignment of a PCP or tailored care management entity will begin. Of course, members can begin requesting non-emergency medical transportation services in October. That's a very important milestone, and we are available to assist if any problems come up with that. And of course, tailored plan members will be getting their welcome packets in early November, and then services begin on December 1st. So currently we have LME MCOs in North Carolina, and these entities manage the care of beneficiaries who receive services for mental health disorders, substance use disorders, intellectual and developmental disabilities, or traumatic brain injury. And what we know is that when we reach that future state, we'll be in a system of tailored plans. And so the tailored plan is an entity that integrates the management of all of these different services. So that tailored plan is going to be handling physical health services, pharmacy benefits, behavioral health services, tailored care management, and of course, any waiver services that are applicable to their region. The differences between LME MCOs really and tailored plans is really central to the management of whole care. Right? So LME MCOs have existed up to this point, only managing behavioral health services. And when we transition, tailored plans will be managing all of those encapsulated services that we've discussed. In most cases, that means that physical health providers do need to be in the tailored plans provider network. And if they are not, individuals may likely have to change to a different physical health provider. There are some other options as well, but that is a key aspect of tailored plans that we are assisting with right now. So what are the goals? The goals of this tailored plan launch are really to ensure a seamless transition as much as possible for the people who are within these systems. And we want to make certain that beneficiaries who receive enhanced behavioral health services are transitioned smoothly on December 1st. I'm going to pause for a minute and just find out if there are any questions we want to address now, or do we want to go ahead and finish up before we take questions? And I'm open to either.
Dylan, if you want to go ahead and finish up, and then we'll take questions.
Wonderful. Thank you, Beth. I appreciate it. So in terms of an overview about tailored plans and understanding what's a little different, this is sort of a side-by-side for standard plans and tailored plans. Standard plans address a different set of services. There are many services that are the same between these two, but tailored plans do provide the same services as standard plans and additional services for individuals who experience mental health disorders, substance use disorder, intellectual developmental disability, and TBI, as well as state-funded services. So the enrollment for tailored plans is different than the enrollment for standard plans because enrollment is based on administrative county, and there is only one tailored plan per county. So if a beneficiary's administrative county changes to a different service area, they would move to a different tailored plan that offers services in their administrative county. These are the counties. You can see all of the different regions and different services available, or excuse me, different tailored plans available in those individual counties. And again, the tailored plan service area is based on the county that manages the beneficiary's Medicaid case. The tailored plans provide integrated services across all of these different types of care for beneficiaries who qualify for those tailored plans. They also offer added services such as wellness programs, as well as non-emergency medical transportation, tailored care management, and state-funded services. So how do we prepare for this system? What are we doing next? Really understanding auto enrollment and understanding that individuals who are qualified during this time period are going to receive notices from the enrollment broker. So keeping an eye out for those notices. And some individuals won't be auto enrolled in tailored plans, but they might have the ability to choose them. So if you have questions about any notice you receive, you would want to contact either the enrollment broker or the tailored plan for assistance. And then, of course, during the choice period, which is where we are right now, individuals can choose a primary care provider and a tailored care management provider, or a different health plan if they are eligible to do so. And in all of those processes, if you have questions, communicating with the enrollment broker and the tailored plan are the best options. And of course, the tailored plan is your point for selecting a primary care physician or a tailored care management provider. Auto assignment will happen just after mid-October. And that only occurs if someone hasn't made those selections. And then, of course, after auto assignment, we will see packets being mailed to members for receipt in early November. To be prepared, you want to make sure that the Department of Social Services has a current mailing address, phone number, and email address to ensure that all materials are received. You also want to be certain that any changes around income or a change in household size that can affect coverage is something that has been communicated to DSS. And of course, keep an eye on your mailbox, check for notices and open those, read them. If you don't understand them, you can call any of the phone numbers you'll find on those notices. And that does include the Ombudsman. We are one of the resources for helping you understand these changes. We do have some provider notices, and we'll share these slides with partners. So if there are provider questions, these are just some resources that are available. Of course, as well as the provider Ombudsman is a great resource in our system. So these are just some contact points for the Ombudsman. Our phone lines are open Monday through Friday, every day that's not a state holiday, essentially every weekday that's not a state holiday. And we're open 8 a.m. to 5 p.m. You can email us, you can reach us online. And of course, if someone is in need of in-person contact, we also can make accommodations for that. So that brings me to really the end of our presentation. And Beth, I'll pass it off to you if we would like to take questions and get input from our audience members.
Sure. I'm going to give all of our panelists just a second to get prepared, and I'm going to put us on gallery. If you'll take down your slide deck.
Absolutely.
Okay. So our first question is, our daughter has not received a letter from the enrollment broker. When will they be sent out? And I'm going to let someone come off mute who's ready to answer that question.
I can tell you how we address that question. So if you haven't yet received a letter from the enrollment broker, most of those letters were mailed in the last 2 weeks. You can contact the enrollment broker to find out if you should have received a letter. Not everyone will receive a letter. If they are not moving, there are classifications of beneficiaries who will not receive letters. However, you can contact either the enrollment broker or the Medicaid Contact Center. Either one can assist you in finding out what the current eligibility for your child is and whether or not that would mean that they might be moving into a tailored plan or into a plan of a different type.
Thank you. Okay, our next question is, if participants do nothing, will they keep Medicaid Direct for IDD Innovations, Medicaid V3, and state-funded services?
So I can answer that. If they're an innovations member and they're receiving innovations waiver services, they will be automatically enrolled into the tailored plan. And the B3 services will be changing to the I waiver services. And state funded services are eligible to Medicaid Direct as well as tailored plan. Depends on their need and what plan they're in. And I will have Dylan fact check me on that.
Yeah, that all sounds correct. The only thing I would add is both those involved in the innovations waiver and those on the wait list.
Yes.
Yeah.
And that is different from last launch at standard plan.
Yes. And that's something that we know a lot of folks have questions about.
Right, right.
Okay, our next question is, where can we find an updated list of primary care physicians who have enrolled as providers in our county for the tailored plans?
The best place to go right now is your MCO's website to their provider search. The state also has a tool on the NC Medicaid beneficiary tab. It's a provider search tool. But you can start with the plan. So Partners has a tailored plan webpage, and there is a provider search on there at the top. But keep in mind that providers are continuing to contract with Partners and will continue to do so for quite a few months.
Okay, the next one is a comment that letters that were dated August 25th, and most got them around 3 days later. I do know of one person that did not get theirs till yesterday.
Okay, so those letters have come from the enrollment broker, and some of them are late. They are coming through. Originally, when the enrollment brokers sent those from Medicaid, Partners' phone number was incorrect. We want to make sure we put the correct phone number in the chat. They put 1-800-235-4673, and the correct number is 1888. So it's a matter of two numbers. So you may have had calls, like the robocalls, they call them, telling you about that, as well as resending of letters. And if you did not receive a letter, you may want to check with your county Department of Social Services, Medicaid, with your caseworker to make sure that they have your correct address on file. And also, we'll put in the chat the Medicaid transformation at NC DHHS website, where you, anyone can let the NC Medicaid know of any issues that you are having so that they can work to resolve those. Dylan, you want to add to that at all?
No, I think that's pretty much exactly the guidance I would give. So go for it, Allison.
Okay. Feel free to jump in. And same with the other panelists.
So our next question is, it seems as if the state is only telling individuals that MCOs are their only options. They aren't being open about care management agencies being an option. Is the ombudsman providing education about all of the options, including CMAs?
Hang on, I want to see if I can see this question. Care management agencies are an option for care management. That's absolutely true. And we do inform individuals that there are a variety of care management options. So yes, the tailored plans are available. However, in addition to tailored plans, advanced medical homes are available in some cases as a care management option. And a variety of those. So those are conversations we definitely have with beneficiaries to talk about the fact that they have a variety of choices, especially right now during the choice period. So my response to this would be absolutely. We are talking about the diverse set of options available in terms of care management entities. And if you have questions about that, feel free to call.
Thank you, Jill.
And I would add that partners, care managers, you may refer to them as a care coordinator. They are reaching out to all members to talk to them about the choice and offer them the choice for community or the tailored plan. Yes. And unbiased conversation with the same script.
Yeah.
Okay, the next question is, I have contacted my current providers and none of them are participating in the tailored plan. So what do I do? I have quite a few specialists that I see.
So that's a great question. It's a question we are getting regularly at the Ombudsman. I feel free, anybody else, to chime in on this. If this is a situation that you are experiencing, please feel free to call the Ombudsman. We can assist in evaluating what providers are available. We can also assist in communicating with both tailored plans across the state, and in some cases, we can provide referrals to assist in determining what your right next step would be in this circumstance. The state has put in place a number of, they're called transition of care protections that exist to allow individuals to continue to receive services even from non-contracted providers as this transition occurs. So we can do some education with your providers. We can do some education and encouragement, frankly, because part of the situation right now is this whole system transitions is helping providers understand the benefits of being enrolled as a tailored care provider. And, for providers to know that they have a variety of patients who may need these services from tailored care tailored plans. That's some communication that we are doing. So I would encourage you to reach out to the Ombudsman and hear about your options, your choices, and we can open a case for you. And as you move forward through this process, we know that providers are continually onboarding, but if there comes a time when that becomes an issue for you, we can provide referrals and assistance with figuring out what the next step is.
Yeah, and I'll add a little to that, and then Danielle may want to add a little. So partners right now, and there's a message on our website that gives a little bit of this information, but we're encouraging you to call member engagement or our member services, which is Partners Access, to let us know what your choices are. And that maybe the information that they're not willing to contract or that you would like them to contract. And our provider network staff and those specialists and designated folks are working to build the network. They're working to encourage members to contract with us to better serve our membership. Danielle, did you want to add anything to that?
We are reviewing the information every day. We are working with our standard plan health partner to get as many providers, contracted with us as absolutely possible. We are getting a daily feed of information from our health partner. So please just, it's hard to say in this time, but we are working diligently to try to get as many providers into our network as absolutely possible, but it is taking some time to get that done.
Thank you. It seems like some of the enrollment brokers have no idea about care management agencies. When someone I supported tried to enroll with a CMA, the enrollment broker said that it wasn't an option, and he feels like they called him a liar. What is North Carolina doing to ensure that the enrollment brokers are educated about everyone's options?
I can respond to that if other folks don't have a response. So the ombudsman actually works pretty closely with the enrollment broker and with the Department of Health and Human Services about monitoring the experiences of beneficiaries when they contact the enrollment broker for these types of questions. If you have this kind of experience, please do reach out to the ombudsman. We can assist with connecting to the Department of Health and Human Services. Technically, also, an individual could file a grievance or a complaint about receiving that kind of, or having that experience and receiving poor information, misinformation. We do track and trend misinformation across North Carolina Medicaid, so that's part of our role and responsibility. And if you have the name and of the individual that you spoke to and the time of the call, the Department of Health and Human Services is very invested in going back and listening to those calls and being certain that this information provided is correct. And that, you know, if there's a problem with that, we follow up, we communicate. So I'm sorry that that happened, and, you know, reach out to the ombudsman. We're happy to help and provide support and be certain that that gets corrected and communicated, really.
Okay. Next question, as a QP, I'm worried for my state-funded supported employment individuals and what it will look like with Tailored Plan and my B3 personal assistance individual transitioning to long-term community supports. How to address this transition?
We would definitely encourage you to have the member, work with the member to talk with the care manager about that transition and the crosswalk to the new services. I think you'll find that there are quite some nice opportunities with the I-waiver services that are expanding. Many are not going away. So supported employment is an important service, and that will remain. But for better information that's individual to the situation, please have a joint meeting or contact that care manager.
Okay. When will we have information on what I-waiver services will be offered? As my understanding, it is that not all B3 services are crosswalking over to I-waiver, as some B3 services are ending?
Most of them are crosswalking. We will be presenting on this topic after the state is opening up to member and community trainings after October 15th. So we will have very specific trainings about the new waiver services and separately state funded services and what benefits are available.
Okay,
Beth, can I add to that just real quickly?
sure.
So keep your eyes open for some information. We're going to be having a virtual series all about the tailored plan. Going to give you a nice overview, going to talk about primary care providers, tailored care management, what Allison just talked about with the services. So we are offering, like I said, a great virtual series that'll start around mid-October-ish. And it's going to run all the way through December, end of December. So keep your eyes open for more information about that. We're excited to be able to provide that for you.
Okay, our next question is, Where can we get a summary of benefits for the partners' tailored plans? Can you also speak about out-of-network providers and how that will work with partners?
Okay, I can take the first part, and I think Melissa has just entered in the chat some information. The handbooks that will come in paper format to you by early November will, and it'll be around that time, late October, early November. You will be able to see the full list of benefits that include physical health, and those are for tailored plan members. Then again, joining some of our, or watching the recording of that will, or the voiced over version of the PowerPoints we're going to have on our website. We're going to make sure that you get that information. You can also always have a one-on-one discussion with someone in member engagement, and they can go over those services with you as they're laid out in the for the tailored plan. And then for the out-of-network providers and that process, I don't know if Danielle wants to talk a little bit about that.
Yeah, I can take that part. For the out-of-network providers that we have, currently the out-of-networks come to us through Access to Care or our care management departments. For some reason, the providers in our network are not able to assist with, the member. So we take these out-of-network requests. So those will still come in through Access or care management. We are using information from NC Tracks enrollment for those providers. So as long as the provider is enrolled in NC Tracks and eligible to bill Medicaid at the site that they are saying that they will serve the member, then we can work that out as an out-of-network contract for providers. I will say that providers who are already in our network are not eligible for an out-of-network agreement. We do have that question come up sometimes. So if you are a provider already established in Partners Provider Network, you would simply need to work on adding either a site or a service to your existing contract, because out-of-networks are just for that providers who are not already enrolled in Partners Provider Network.
Can I add that one thing the Ombudsman has seen a lot with out-of-network provider care requests is to talk to your provider about that ahead of time. In many cases, it's not the plan that limits access to out-of-network providers. It's the willingness of an out-of-network provider to go through the process of billing to a plan that they're not in network with. So if you have a plan or an intention to work with an out-of-network provider that you think will likely be approved by Partners, please do communicate with them early and often about being an out-of-network provider for you within your plan, because they need to be willing to do that. Their billing department needs to be willing to do that. And that's one of the biggest challenges that we see for members.
Okay, the next question is, where can we find a list of AMHs?
Okay, right now, I think there's City Block and one more in our area, and I'll have to chat that in a minute. But and then they will be added as they contract and get certification.
Okay, we'll go on to the next one. Will there be another role for community guide / navigator, as this type of advocacy is so much needed and valuable to individuals in understanding this transition?
Does anybody else want to answer that? Since I'm doing all the talking.
Sure, I'll answer that one. So community navigator, community guide, with the tailored plan, most individuals will be eligible for tailored care management, and that is part of the role of the care manager. So therefore, the need is not there anymore. So for example, if you're part of the innovations waiver, you are automatically part of the tailored plan and you're enrolled in the tailored plan. And your care manager, whether it's a care manager with partners, whether it's a care manager with a CMA, a certified care management agency, or an AMH plus, they all follow the same model. And so therefore you should be receiving the same type of care management across the board, which would include the navigator, community navigator or guide.
So I would also add to that one of the services that the community navigator and community guide offer that the ombudsman has gotten a lot of questions about is assistance with filing grievances, assistance with filing appeals, and legal representation for appeals for services if they are denied. The ombudsman is providing all of those services. And so the work of that part of the work of community guides and navigators continues to exist. All the services received from the ombudsman are free. There is no charge for that. Any beneficiary is eligible for services from us. Anyone can call us to get information and questions. So in terms of assuring that North Carolina Medicaid members continue to have access to assistance in dealing with care denials or service appeals or grievances, the ombudsman does exist to provide that part of those services as well.
Thank you. The next question is, can you please not share a list of all docs that are in process of contracting with partners? This would ease families' minds to know the docs are in process.
We are loading that current list onto our provider search. So that's going to be your best way to find out, or to call us and then we can track it for you. But putting a list that's incomplete, I think, could also cause some confusion. You know, that's Danielle, did you want to add to that at all?
Well, as we receive the information from our health partner, when we get that and it's ingested into Alpha, that is turned around into a report that is sent to the enrollment broker for the provider directory. So that is the best way, using those search functions to see, you know, because that it's updated daily. That's the best way to see who we have thus far and that are included in our network. Or like you said, you can call and we can try to track it down for you as well.
Okay, and thank you. And to further clarify, you're referring to the NC Medicaid provider search tool on their site?
Yes.
Yes.
That's what the enrollment, that's going to the enrollment broker that's running their provider directory. Yes.
Okay, we can put that in the chat.
Okay, our next question is, I have been in HCWD for several years. I turned 65 next month, and my understanding is I will not be eligible for full Medicaid anymore starting on 11/1. Cannot get an answer from my DSS caseworker as to what I may be eligible for as far as possible benefits going forward. I need to make decisions about private insurance, managed care ASAP.
I can make one suggestion to help you in your search for answers on that. There is a senior health insurance program. It's called SHIP because we love acronyms. And there is a North Carolina website where you can search for your county and your local county SHIP office. And they are non-biased, most of them volunteers, but well-versed in Medicare and having Medicare and other insurance, Medicare and Medicaid. So they would be a good starting point. If you reach out to us in member engagement, we could also try to assist you with some other resources. I'm sure the ombudsman might have some information on that as well. But I've encountered you call the SHIP office and you make an appointment, and open enrollment is starting. So now's a good time before October 15th, and they might have some better availability, but they're generally very helpful with Medicare issues.
Okay, next question. My daughter's primary care physician is listed on the NC Medicaid Plan's website as Gaston Family Health Services without a specific doctor listed. But from what I understand, Partners is wanting the doctor's name, which is confusing the facility. Which is confusing. This facility has several physicians.
Okay, that is confusing, and we need to correct some language on that. So what's on your Medicaid card and the one that you'll get from Partners in early November will be the practice name. And there's a national provider indicator that's associated with that, and the site where you visit, the location. We are also interested in knowing who your provider is, your primary care provider, because we will be offering, or the community agency will be offering tailored care management, and a lot of coordination needs to happen, collaboration about your whole health needs with that primary care provider. So that is important information for us to know. It's not necessarily going to be on your Medicaid card. We just want that for those purposes.
Okay. Is there a limit to the number of out-of-network SCAs that can be requested?
I'm double checking on that right now just to make sure I do not want to give the wrong information. Currently, as an LME-MCO, yes, we do limit that, but I just want to make sure under the tailored plan, it's not different. So can we please circle back to that?
Danielle, just let me know when you have that answer. Okay. The next one, I'm a bilingual support coordinator. Most of the families that I work with are Spanish-speaking families. Are the numbers and information that you are providing are the same for them?
So I will speak for the ombudsman. We have Spanish-speaking agents available. And if for some reason a Spanish-speaking agent is not available, we will use a language line, though that's not our preferred method. And assign any case that comes in for a Spanish-speaking member to a Spanish-speaking bilingual ombudsman. So all of the information from the ombudsman is generally available in English and Spanish. And we are happy to communicate if there's something that is for some reason not available in some way. We will find a way to make that possible.
And did you want to speak on Partners' behalf when they call? Do we have Spanish numbers? Was that the question?
I sure can. So we do have a bilingual member engagement specialist here on our team. So if you call the member engagement team, Kim can work with your family. She was previously a care manager, so very well versed and highly bilingual. So very helpful. And we also have other folks within Cardinal. Oh my goodness, I can't believe I said that. We have other folks within Partners that speak Spanish as well. So great question.
Great.
Next question is, I have looked this agency up. This is going back to the same person who asked the question about Gaston Family Health Services. I've looked this agency up on Partners Tailored Plan Provider Tool, but nothing comes up with Gaston Family Health Services or the doctor there. Very confusing why on NC Medicaid medical practices are listed as a whole.
So they're not listed as a whole, they're listed as a site. So so that's what we may have, one large practice, like say it's Novant, but there are many different sites, and we have to have that NPI code associated with the office location that you will go to. So that's how it is tracked. What's happening now at Partners to make sure that we can outreach to your providers and hurry them up to get contracted with us is to call us at member engagement or call us through Partners Access and let us know your choices, which we are tracking and we are sharing with Provider Network. And we are also entering them and processing them with the state as soon as they're loaded up, and we're able to do that. So we very much appreciate the information that you'll share with us that'll better, spur things on.
Beth, I have an answer to the previous question now.
Go ahead.
Sorry, I just wanted to make sure that I was given correct information so that I can try to cut down on confusion. So I apologize, I had to come back to it. So Partners is not going to limit the amount of out-of-network or single case agreements that any one provider can have. What we are going to do is when we get that initial out-of-network request, we will offer to contract fully with that provider. And then if the provider declines to contract, they will then be paid at the out-of-network rate, which is 90% of the standard Medicaid rate. So no, the answer to the question is no, we will not limit the number of out-of-network agreements that one provider can have. When we get those requests, we are going to offer for the provider to fully join our network so they are able to serve as many consumers as they choose through an easier, fully contracted process. And then if the provider declines and only wants to do an out-of-network agreement, then they will be paid at that OON rate, which is 90% of the standard Medicaid rate. Unless that has changed as well. And I'm kind of looking at the ombudsman for that. That was the last that I had heard, is that it would be 90% of the standard Medicaid rate.
I'm not certain of the rate, but the time frames sound correct to me. And I believe that's what I've heard from other tailored plans as well. Yeah.
Okay, our next question, we're starting to run short on time. So I'll just quickly read through this one. What will the actual role of the care manager be if they are not advocating?
Okay, you want to read the question that's similar to that about community guide, and I can answer those two together. I can read it. Okay. So the worry is more for those who are their own guardian and have difficulty processing information regarding community guide, navigation, and navigator, and then what is happening with those professionals? Are there positions within the Taylor Plan team to absorb these professionals? So the care manager, part of their role is to advocate. That's certainly true. And even more so because with the whole person, they're going to be focusing on social determinants of health, which are barriers, health barriers that limit you from getting the health care that you need. The other part of that is that there are extenders that are being created and advocates and peer support. So people with lived experience can be added as these extenders as part of the team. Okay, so part of that care team, there's a care plan, and they bring all the right people together. They work within the community. If you have a community care manager, tailored care manager, we're working at the health plan at the managed care level to support any of those care plan needs. So there will be many layers of advocacy, and at the health plans, there are also advocate roles. And then, of course, in the community. But we do fully understand that members who are their own guardians, it is much more difficult to navigate this very complex system. And we want to support them and empower them as much as we can through care management and other resources that are offered through the tailored plan.
Okay, I'm going to jump to the next question. Will the PHPs, Healthy Blue, Carolina Complete Health, etc., also be managing the tailored plan?
So I'll take that one. So the tailored plans will be managed at this time only by the current MCOs. The MCOs will be managing the tailored plan and North Carolina Medicaid Direct and state funded services. North Carolina Medicaid Direct will be just behavioral health. But the tailored plan, as we've been talking about, is both physical and behavioral health. Standard plans do not operate the tailored plan.
Okay, it's 2 o'clock. Do we want to continue on with questions, or do we want to take them down and respond to them?
Okay. There is one in here. Somebody had a question about, well, I think we can respond to some of these offline. So somebody did say, how will we know if a client has the ombudsman tailored plans without calling the insurance directly? There are clients who have come in with Medicaid with Healthy Blue, and they tried to submit an authorization for service and it was denied, and they found out they were in the tailored plan. So checking to make sure with your provider what your plan is, as well as there's NC Fast, or there's a portal that you can use to find out which plan. Sometimes people do change from a standard plan to a tailored plan because they have more health needs that need to be addressed through the tailored plan, and those services are only found there. But please do call us. We've given you lots of numbers and between partners and the NC Medicaid Ombudsman. And Beth, I don't know if you want to finish up. I know that we are going to share the slides. Email us if you have needs about the presentation.
Right. And we want to give a big thank you to Dylan for joining us today. She has shared just some great information with us today. And as I'll just reiterate what Allison said, please call us. Member engagement is here to help you. Partners is here to help you. So don't feel like you can't call us and ask a question. We're here for you. That's our role. So thanks for joining us today. We're so glad that you did join us today, and have a great afternoon. Bye, everyone.